When talking about minimally invasive valve surgery, one has to think about the type of valve that is being addressed and the reason for why the valve is being addressed. There are different philosophies or different preference on the surgeon's level of comfort in doing that, and that's but the bottom line, when someone needs to address a valve problem in heart surgery, you have to keep in mind that the success is not only going to be based on the incision, but on the durability of whatever was done at the time of the surgery. So I would say that if you can successfully have a valve repair with a small incision, then it's better to have minimally invasive. But if that's not achieved at the time of the procedure, then by the surgeon, that's going to be determined by the surgeons, then the standard operation is the appropriate treatment. Now, we like to do minimally invasive repairs for the mitral valve, and we do that through a small incision on the right side of the chest. The patient does need to be on the heart-lung machine like any other mitral valve surgery, but the incision is much smaller, and you can work on the valve through the side and achieve a good result as well, with a much easier recovery for the patient and shorter lengths of stay, less blood utilization, and there are some those are the most benefits that one can get, besides the cosmesis. When talking about minimally invasive for the aortic valve, that also can be approached through a small incision by the sternum, and sometimes on occasion through the side of the chest, and it's also preferable on someone who that's the only procedure that the patient is going to undergo. When someone needs to have a valve and needs to have bypasses and so forth at the same time, that's not appropriate to go through a small incision. So there are indications for less invasive surgery, and there's indications for traditional surgery, and that's basically going to be on the surgeon's judgment. Some of the benefits that people obtain by going through a less invasive surgery is easier recovery for the patient, because they don't have to have the full sternotomy incision through the side. There's also less pain associated with it. There's less blood utilization, less chances of having infections on the wound, and also in women sometimes can be attractive cosmetic-wise, because you don't have the incision in the middle of the patient's chest.